How can we study an outbreak that hasn't happened yet? Influenza pandemics are one of the biggest threats we face, with the potential to kill millions worldwide. But what will the next one look like? It's a difficult question because historically, flu pandemics have all been slightly different. There were different strains of the virus, and outbreaks hit some places and people harder than others. There's a saying in my field, if you've seen one pandemic, you've seen one pandemic. What we need is a way to separate things that are specific to a particular flu outbreak from the underlying principles that drive all these epidemics. This is what my research aims to do. For example, it's likely that social interactions are important in spreading flu. During the 2009 pandemic in Hong Kong, there were lots of infections in busy places like schools. But we also know that children had less immunity to this virus than adults. So what kind of behavior is actually important for epidemics? Conversations? Close physical contacts? What sort of data should we be collecting before an outbreak if we want to predict how infection might spread? To find out, our team built a mathematical model of the Hong Kong outbreak. Using data on social behavior and immunity, we tried to predict different people's risk of getting flu. We created over 100 models in total, covering a whole range of behaviors. The most accurate ones showed that if we want to predict infection patterns, we need data on physical contacts, things like handshakes and hugs. We also need to know who these contacts are. Our risk of flu infection drops when we leave our childhood and enter our 20s, but it increases again when people become parents. This approach was powerful because it wasn't limited to one location. Once we knew which kinds of behavior were important, we could put in data from any country. For example, Hong Kong residents typically have physical contact with around 5 other people each day. The UK is similar, but in Italy, the average is 10. It was a promising start, but to predict epidemics, we don't just need to know how many contacts people have. We need to know where they travel and where the infection might spread. Unfortunately, it's been near impossible for academics like me to collect all this information together. So we've been taking a different approach. My collaborators and I have been working with the BBC to run a major public science project in the UK. Supported by a huge media campaign, we invited the country to download a specifically designed phone app. After collecting information on things like age, occupation, and overall health, the app tracks people's approximate movements and lets them record the sort of social information that we know is important. Previous studies have obtained movement data from cell phone companies, but there's always been a big piece missing. In these data sets, we don't know who people are and what interactions they're having, either because this information wasn't collected or because companies don't have users' permission to share it. Our approach solves this problem. We made sure the study is anonymous, and crucially, we have people's consent to analyze and share their data. Remarkably, over 50,000 people have signed up so far, from school children and pensioners to healthcare workers and students. The study is ongoing, but if we look at the movements of some of our initial participants, we can already see what an average day looks like for different age groups. Each dot represents someone who took the time to contribute to our study. It's an incredible example of how a population can collaborate on a massive research effort that will benefit us all. And we want these benefits to spread. When the study finishes, we're going to publish the data so any research group can analyze it. It will be free to use, the largest data set of its kind ever made publicly available. With such data and our growing insights into how behavior shapes epidemics, we'll be able to study flu pandemics in a whole new level of detail. We can look at how quickly they might spread and which groups might be most at risk. We can also see the potential effects of control measures like school closures or vaccination campaigns. And we'll be able to do all of this before the outbreak hits. Thank you.